How do blood tests check CF pancreatic enzyme levels? When it comes to cystic fibrosis, or CF, blood tests play a vital role in checking pancreatic enzyme levels. These tests primarily measure specific enzymes produced by the pancreas, including immunoreactive trypsinogen, lipase, and amylase. Understanding how these enzymes function helps evaluate pancreatic health, especially since many individuals with CF experience pancreatic insufficiency. One of the key tests is the Immunoreactive trypsinogen test. This test measures the level of trypsinogen, which is a precursor to the enzyme trypsin. In newborn screening for CF, elevated levels of immunoreactive trypsinogen can indicate pancreatic damage. This happens because damaged pancreatic cells leak trypsinogen into the bloodstream. While monitoring immunoreactive trypsinogen levels can provide insights into pancreatic function, it is important to note that this test may not always detect partial pancreatic insufficiency. Next, we have the lipase and amylase tests. These tests measure the levels of lipase and amylase in the blood. Lipase is crucial for breaking down fats, while amylase helps digest carbohydrates. Elevated levels of these enzymes can suggest pancreatic inflammation or damage. However, in the context of CF, these tests are not typically used to assess enzyme production directly. Instead, they can help identify acute pancreatic issues that may arise. Another specialized test is the malabsorption blood test. This test involves administering specific fatty acids that requiring pancreatic enzymes for proper absorption. Afterward, blood levels of these fatty acids are measured. This helps assess how well pancreatic enzymes are functioning in fat digestion. The malabsorption blood test can also provide insights into the timing and effectiveness of pancreatic enzyme replacement therapy. While blood tests are useful, they do have limitations. Direct pancreatic function tests, such as pancreatic stimulation tests, offer detailed information but are invasive and not routinely performed. Blood tests measuring pancreatic enzymes provide indirect measures of pancreatic function and may not fully reflect pancreatic exocrine function, especially in patients with some residual pancreatic activity. Therefore, these tests are often used alongside clinical assessments and other tests, like fecal pancreatic elastase 1 measurement, which is currently the most reliable screening test for pancreatic insufficiency in CF. In summary, blood tests for pancreatic enzymes in cystic fibrosis provide indirect measures of pancreatic function. They help quantify enzyme levels like immunoreactive trypsinogen, lipase, and amylase. Specialized tests, such as the malabsorption blood test, can further assess enzyme activity related to digestion. However, these blood tests are part of a broader approach that includes stool tests and clinical evaluations to effectively manage pancreatic insufficiency in cystic fibrosis. Always consult healthcare professionals for personalized medical advice and to understand the best monitoring strategies for individual health needs.